Apeksha Dhole, Professor Oral Medicine and Radiology, and today I'll be the mentor for topic faulty radiograph. Now, the content for today's topic, one minute. Content for today's topic are introduction, definition of ideal radiograph, types of error and its correction, like types of error, technical error, exposure error, processing error, and the different references used for this presentation. Now, a radiograph is two-dimensional representation of a three-dimensional object. As we all know, teeth is a three-dimensional object, and what we have a two-dimensional object representation is the IOPA radiograph or the X-rays. Now, to obtain the maximum value from a radiograph, it should have a desired accuracy. Poor radiograph contribute to the loss of diagnostic information to the clinician. So, we want the basic requirements of our radiograph are, it should be accurate, it should have optimum density, optimum contrast, covers the area of interest completely, there should not be any magnification or distortion, there should be maximum detail and sharpness with that image and the proper resolution. Now, I am not going to in detail because this is entirely a different topic like image characteristic, where we consider what are different heads. Under these different heads, your radiograph will become ideal radiograph. And so, if these properties are not seen in your radiograph, you have to consider that your radiograph is a faulty radiograph. Now, ideal radiograph by H.M. Worth is an ideal radiograph is one which has a desired density and overall darkness and which shows a part completely without distortion with maximum detail and has the right amount of contrast to make the details fully apparent. That is, your radiograph should contain all these things, then your radiograph should be ideal. And why we want ideal radiograph? We already discussed, so that the clinician should diagnose the case clearly, completely, and should treat the case appropriately. Now, there are different types of error. Like the errors may be because of technical problem, maybe because of exposure or because of processing. Now, there are different stages of IOP or the radiograph to from technique to the processing. And so the error occur at any of these stages. Any problem, any error, discrepancy will occur to the resultant radiograph. Now, what are these technique errors? Like patient preparation error or film placement or projection error. In patient preparation, there are radiopaque artifacts or blurred image. Now, what these radiopaque artifacts? Like we all have seen either sometimes these radiographic error, like what these are, there are some prostheses. These are some prostheses which is patient has wear. The spectacle, and these are the nose rings. That is dental appliances, body piercing jewelry, eyeglasses during exposure leads to the appearance of a radiopaque artifact superimposed over the dental images. Now we want this bony architecture, and here because of this prosthesis we cannot see. The same case here, the periapical part is not seen because of the spectacles patient has wear. And so it is very important that we should know what these, whether they are the part of your prosthesis, they are why this error has occurred. Now, how to correct? Patient should be asked to remove the dental appliances, jewelry and eyeglasses. Again, which appliances to be removed and which should not be, that should be considered first. Then blurred image. We all have seen the blurred images blurring when it is not clear or the borders are not sharp. The movement of film, patient or a tube head during exposure make the image blurred. Now, how to correct? Proper explanation of a procedure to the patient. We have to explain patient, not in detail, but brief explanation is mandatory. Then use film holder that will avoid the slippage of the film. The tube head must be stabilized before the exposure. Again, it should not be held either by the patient or not by the operator. It should be stabilized itself. Then film placement and projection errors. Like there are the list of the errors which is caused because of the film placement and projection error, like partial images, then overlapping of the teeth, then there may be tilted or tipped occlusal plane, shape distortion, size distortion, tire track appearance, black dot in the apical area, artifact on the radiograph, double images, and phalangemas. We'll see one by one. Like apical end of a teeth cut off. The term itself, that is, we cannot see the apical end. Again, it is very important because it is a periapical pathology can be seen only when you have the radiograph with all the periapical things visible. But if your radiograph is not showing, now what are the different causes? If the film is not positioned apically enough to record the entire tooth, the one reason, then film placed too close to the teeth in the maxillary arch when using the paralleling technique, and decreased vertical angulation when using the bisecting angle technique. We already have one video where I have explained in detail how this bisecting angle technique and paralleling angle technique are advantageous, and it can be used to the maximum. But still, if the error like this occurs, you should identify why they are. Then how to correct? Place the film slightly away from the teeth in case of a paralleling technique. Increase the vertical angulation, especially in case of a shallow walls. Place the film in such a way that it extends 1/8 of inch. That is 1/8 of a periapical area should be covered. Then coronal cutoff. Now here I cannot see the incisal edges. Now not enough film is showing below or above the crown, and decreased vertical angulation causing elongation. Here the causes are how to correct. Approximately 2 mm of film should be below the crown, and increased vertical angulation may resolve the issue. Cone cut. Can you see? This is a X-ray film, and the radiograph is showing this round border. Now, cone of a radiation, the round cone of a radiation not covering the area of interest. Now, this is an area, complete area of interest is this, but if it is not covered, only this much part is covered, it may show the shape, the circular shape. The PID is not properly, PID, that is position indicating device, is not properly aligned with the periapical film holder. So you may see this type of error. How to correct? Make sure that the cone is properly centered over the area of interest and the film both are vertically as well as horizontally placed correctly. Position the position indicating device carefully. If a film holder is used, make sure that the PID and the periapical film holder, they are aligned properly. Aligned properly, that it should be centered properly. The film should be centered. Now overlapping of the tip. Here can you see there are overlapping of the horizontal surfaces. Now plane of film not parallel to the lingual surface of a tip. Incorrect horizontal angulation of the cone. This may lead to the overlapping of a teeth. How to correct? Place the film parallel to the lingual surface of the teeth. Parallel means the tangentially. The central ray of the X-ray beam should be directed perpendicular to the facial surface of a teeth. And ideal horizontal angulation should be 0 degree. Then tipped or occlusal. Can you see this is a tipping of the occlusal plane? It is not straight. Ideally it should be straight or it should be parallel to the edge. The edge of the film is not placed parallel to the incisal or the occlusal surface of the teeth. So it is called tilted or tipped occlusal plane. If a patient is not instructed to hold the film firmly against the tooth when finger holding method is used. So in case of a bisecting angle technique, this is the common error when we have not instructed the patient properly. Then how to correct? Make certain that the edge of the film is parallel before you expose the film. Occlusal surface of the teeth, instruct the patient to hold the film correctly and firmly. Again, there are certain image distortion which may cause the size and the shape distortion, like foreshortening, elongation, and magnification. What do you mean by foreshortening? The term itself, the shortening of the image. What are the different causes? In bisecting angle technique, the vertical angulation of the cone is too increased. And so can you see these all the root apices and the tooth, they appears to be shortened. Now how this diagram is showing how exactly it may be foreshortened. Now film is not placed parallel to the long axis of teeth. Now, can you see here the film is placed at an angle? It is not parallel. And so this might be the reason of foreshortening of the image. Correction, reduce the vertical angulation or place the film parallel to the long axis of the teeth. Then the next is elongation, exactly opposite to the foreshortening. Here the tooth will appear elongated. In the bisecting angle technique, the vertical angulation of the cone is decreased, or the film is not, here the film is not placed parallel to the long axis of teeth. And so the reason may be elongated image. How to correct? Increase the vertical angulation or place the film parallel to the long axis of teeth. Now the third in that is the magnification. Magnification, the size will get increased or decreased. The decreased focal spot to object distance or increased object to film distance. Now you can see the images over here. Here there is the normal one, but here if the distance is increased, if this distance is decreased focal spot to object distance, and here increased. In both the cases, what you can see, there is increase in the penumbra, and so you will see that the images will appear magnified and as well as slightly blurring also occur. Correction, long open-ended aiming cylinder should be used. Now tire track pattern. Now this is actually the tire track pattern, and this is a honeycomb pattern. Now all these patterns are because of the lead foil which is placed on the backside of the film. The film packet itself contains the lead foil. Now that lead foil is having different appearances. The earlier it was having the honeycomb pattern, or most of the occlusal films it is having this honeycomb pattern, and the IOP films recently what we have is this tire track pattern. Now this tire track pattern is the for identification whether your film is placed correctly or not. Now if it appears on your radiograph, that means your film, you have placed the film in an opposite way, backside of the film, with the lead foil placed facing towards the cone, which is a wrong side. Okay, how to correct? Always make sure to place the pebbled side of the film, that is the white side with the convexity towards the X-ray source. Black dot in the apical region. Now we all know this convexity, it should be on the incisal surface. It should be on the incisal surface. But if it is on the apical region, what will happen? The earlier this convexity was very prominent, and in the earlier radiograph, what we can see this type of radiolucent dot, and we all know this radiolucency is mimicking the pathology. Like periapical pathology also appears in the radiolucency. So we should avoid. Now, what are the different causes? Manufacturer identification mark on the film placed towards the apical area of the teeth will cause this black dot in the apical area of the resultant radiograph. You have to feel this dot and you have to place this convexity in the apical in the incisal region, incisal or the occlusal surface. Now artifacts on the radiograph because of writing lines on the radiograph, black marks on the radiograph, or black lines on the radiograph. What are these things? Writing lines. Can you see these writing radiopaque lines? Now writing lines on the film packet. Most of the time what happened, the student used to write on the surface which gets exposed to the X-ray source, like the white side, and they go on writing with the ball pen with the pressure, and so you may get this type of indentations or the writing lines. Now how to correct it? Either use a crayon type of pencil or use the backside of the film packet. Then black marks. Can you see these black marks? The moisture contamination or failure to blot the film packet make this type of black marks on the resultant radiograph. How to correct it? Blot the film packet immediately after removing the patient from the patient's mouth. Sometimes the saliva which is coming may sip into the packet and may lead to the such type of black marks on the radiograph. Black lines on the radiograph. Can you see these black lines? Purposeful bending of the film. Sometimes what happens? To keep it in the shallow arches, the student used to bend it more, and so this bending will cause the black lines on the radiograph. Correction: film bend must be kept to a minimum and be strategically located so that bends do not interfere with the major image of the film. Now, where to bend? It should be, if at all, if it is important and necessary, where exactly you want to bend, uh, it should be strategically decided and then you do. And again, it is not the the pressure should be applied. It should be a light bending is required, not the strenuous bending where the film may get distorted and the image will be the resultant image what we get with the artifact. It should not be there. Then double image. Now this is very classic. Can you see the images which is present on the horizontal as well as on the vertical manner teeth are? Now how it occurs, that is film exposed twice. Sometimes this occurs in the institutions or sometimes in a hurry. The person has exposed the film, he has placed it in the tray, and the another one or the someone who the same film is exposed twice. The same this type of double image will be appear on the radiograph. Correction: place the exposed film in a separate container or a box so that it will not be mixed, and such type of errors should be avoided. Then phalangioma. Phalanx, that is the finger. When the finger holding method is used with the bisecting. But how? If it is being placed in such a way that finger comes in in the central ray. Now make sure that the patient's finger used to stabilize the film is placed behind the film and not in front. If it is placed in front of the film, then only you will have this image. So the film holding method should be discussed and shown clearly to the patient. Then exposure error like dark radiograph and light radiograph. Dark. Now there are different reasons, like exposure time is too long, MA is too high, KBP is too high, source to film distance is too short. Dark means the radiograph. This radiograph, can you see? This radiograph is somewhat darker. I cannot identify the different landmarks completely, clearly. Then correction, set exposure time correctly, increase the source to film distance, decrease the KVP, decrease the MA or exposure time. Now for IOP radiograph, we cannot do this MA and KVP sources. For extraoral, yes, it is we can do. This exposure time parameter we can change in the IOP radiograph also. Now light radiograph, opposite to that of a dark radiograph. Now this radiograph again is of no use if it is not showing me clearly my periapical pathologies or my landmarks. The causes are too short exposure, too low MA, too low KVP, increased source to film distance, and how to correct. Set the exposure time correctly, increase the MA, increase KVP, check the source film distance. Now there are processing errors. The dark radiograph can also occur, light radiograph can also occur. We have recently seen it because of the patient preparation, but can be because of the processing error also. Like then partial image, black artifact, white artifact, black streaks, stains, veins, moisture contamination, tar, emulsion, scratches, static electricity, and film fog. Now it is very important the identification of a radiograph and why this occur so that we can rectify. Now we'll see why the dark radiograph. It might be because of developing time is too high, developer temperature is too high, inadequate fixation, accidental exposure to the light, and improper safe lighting. These all may be the causes for dark radiograph. How to correct it? Keep a check on a developing time. Lower the temperature of the developer solution to 70 degrees. Fixation time should be standardized. All darkroom procedures should be done in a safe light only. In light radiograph, the causes are developing time too short, low developing temperature, and excessive fixation. This is a light radiograph. How to correct it? Keep a check on a developing time. Maintain the temperature of the developer solution to 70 degrees. Fixation time should be standardized. Partial image. Now the partial image here, what we can see is this type of partial image. Okay. Now how this and when this occur? The partial immersion of a film in the developer chemical. When you are inserting the film in the tank, if it is having low level of a solution, or if you are not inserting your film completely, you may see this type of partial image. The correction, replenish is necessary in every 1 to 4 weeks depending on the rate of use. Replenishing is you have to place the level of the solutions to the up to the level, that is at the upper level. Then black artifact. Now here the black artifact I have shown, it is different everywhere and the causes are also different. But the basic cause is contamination of a radiographic film surface before immersion into the developing solution. It can result into an artifact on a finished radiograph. Now how and when? Corrections, the darkroom working surface, the operator hands and the film packet. Here you can see this is a film packet. Here you can see the operator hands and this is because of the dust particles. Now careful handling of the film by the film holder will prevent the unnecessary artifacts like fingerprints. Now white artifact, can you see these white artifacts? The pre-contamination of the film surface with droplets of a fixer solution as well as air bubble. Now these droplets, or if they are round, we can say the air bubble, the water droplets may be of irregular shape. The shape and the sizes may be different during the initial immersion of the film in a developing solution. Before it get immersed into the solution of a fixer, if it is having the drop on the film, you may develop this type of artifact. The corrections, clean and dry working surface is very important for proper processing. Gentle agitation of the film is necessary so as to remove all the air bubbles. If air remains in contact with the film, it will have this round type of reduces opacity. Then black streaks. Can you see this black streak? It is the failure to agitate during developing. Undue amount of inspection. This is very important. In the initial stages, we all do this type of mistake. Undue amount of inspection of a film during development and insufficient fixing. This may lead to the black streaks. Now, how to avoid this? Agitate the film on immersion, immersing them in the developer. Keep check on the developing and the fixing time. You have to monitor yourself. You don't have to go on checking, go on removing it at every seconds. Rather, you think that how much time is given for this. The time temperature method is very important. Brown stain. Can you see these two radiographs which is having the different type of stains? Now these brown stains or the green stains, the improper washing of the film after fixing and developing. Now corrections, a thorough rinsing of a processed radiograph necessary. Now how much it is running after 30 seconds and after developing and 15 minutes after fixing. 15 minutes I'm saying it is very important to wash out all the solutions so that your radiograph should not have any of these chemicals on the film to stick. If it is there, it will cause the reaction and you may have these type of stains on the radiograph to develop. Now bend artifact. Can you see these different type of vertical black lines on these that is the oblique lines on the radiograph? This purposeful bending of the film to reduce the patient discomfort. Now these are mostly on the corners you can see. Now this is because so that the patient should not feel any discomfort and we go on bending the sides. But the film bending must be kept in a minimum and be strategically located so that the bend do not interfere. Again, the bending is not the solution. You can use the small size radiographic film also in those cases. Moisture contamination. Can you see the saliva contamination of the film packet may cause the inner black paper wrapped to adhere to the film emulsion, producing the black artifact. That is, this is the black paper which is stick to the film and is causing the black artifact. Correction, film packet should be wiped off with a paper towel before inserting them into the. We should not insert it with the paper clinged to that film surfaces. We should remove it before it is placed in the developing solution. Then torn emulsion and scratches. We all know the once you remove the film, it should be dried. Otherwise, what will happen? Careless handling of the film, especially during the film processing when the emulsion is soft and swollen, results in the removal of the emulsion and scratch will be visible on the surface of the film when examined on the reflected light. You can see this line. But if it is on in such an area, this is on the area which is not causing any diagnostic loss. But if it is in such an area where it is causing some misinterpretation of a radiograph, will be very hazardous. So You have to correct it by careful handling of the film is necessary when you are doing the processing. Once your film become dry, your emulsion scratches or torn emulsion possibilities becomes less. Static electricity, again, can you see these tree shaped radiating lines in the radiograph? Now, when this occur and why this occur? A dry indoor environment combined with the rough unwrapping of the film may produce a small charge of electricity that produces on the film. That is, when you remove the film from the film packet very swiftly, then it may causes the generation of the static electricity, and after you process it, you may see this type of static electricity, black radiating lines on the radiograph. Correction: humidifier should be used to control humidity, and do not remove the film very rapidly. Film fog, light leak into the darkroom or improper filter, outdated film, improper film storage at a high temperature, at a humidity level, high humidity will lead to the film fog. That is this black discoloration. Now, types of film fog, it might be chemical fog, it might be radiation fog. Chemical fog, temperature, overdeveloped, contaminated, exhausted developer will lead to the chemical fog. And radiation, when it is exposed for a prolonged time or in a safe light or excessive bulb wattage, radiation before and after exposure may lead to the film fog. Correction: check vents, doors, walls for leakage, cracked, safe light. That is your light in the dark room. It should be safe. It should not. There should not be any leakage the light. Then reduced exposure time of the film, so to the safe light, so that there should not be any film fogging. Complete clear film. This is very classic. Complete clear film. Film is not at all exposed, and placing the film packet to the fixer first. If someone is not is new to the darkroom and has placed the film directly to the fixing solution, it might be a complete clear film. Complete black film, the film exposed to the light, and it may be complete black film. So this all about the different type of errors or artifacts which leads to the faults in the radiograph. So to conclude, strict adherence to the principle of patient management, technique, film handling, film storage, darkroom procedures will eliminate the needless additional radiation exposure to patient due to faults in the radiograph. Our aim is to get an accurate and accurate diagnostic radiograph, and that can be that we can get if our radiograph is not having any faults. If we go and check all these parameters, we may have the radiograph without any faults. But again, the faults are important to know. If you know the faults, what are different faults and why they occur, then only we can rectify these faults and we can get the ideal radiograph. With this, these are my different references. With this, I think students, I have made the topic easy for you, and if any queries, you can mail to me. Thank you.